Welcome back with the President of European Medical Association, Dr. Vincenzo Costigliola, continuing our interview about the topic of future pandemics. Dr. Costigliola, which is, according to your experience and knowledge, the position of the majority of European doctors in regard to environmental concerns, for example, the global warming?
Well, first thing is not if we have the new pandemic, but is when we expect the pandemic. This is number one. Second one, we really realize is important the global approach to the pandemic. Global approach means we need to be prepared when the next pandemic appear. We need to know exactly immediately where start. We need to know, identify the agent, and we need to prepare the measure to combat this pandemic. The important once more is the information, the correct and validated information for all healthcare professionals, and of course the good information from the politicians.
Preventive measures by vaccination may be eased by policies of suspension of industrial patents, rights of property.
You are right. The problem is this one. We have two aspects. One is the ethic aspect. Second one is the commercial aspect. In the ethic aspect, of course, we need to offer the best access to the medication, to the drugs, to everybody. In the other hand, we need to consider what is the role of the pharmaceutical industry, because the only one thing they really understand is the profit. We need to consider this aspect. If we decide, and when I say we decide, all politicians, the representative of all nations decide what is the emergency, in this case it's possible to suspend the patent and to offer the medication, the vaccine to everybody. But the main problem is not this intellectual aspect, the intellectual property. The problem is the capacity to produce the medication, to produce the vaccine, because it's not only the patent, but it's the possibility to produce. If we need 1,000 and 1,000 doses every day, we need to have the factory capable to support these needs.
Better informed doctors treat patients better. This is one of the key statements of EMA. Are we working for this purpose?
Our role of the professional association is to inform and to involve the doctors. And when I say it's not doctors, it's in general the healthcare professionals, where everybody is involved as a person, as a group, as organization. Once more, I insist the first step is the validated information. Second step is the right training for the healthcare professional. And of course, the third one is the political impact.
Thank you, President Costigliola, for your intervention and your availability. We wish you a good job.
Thank you very much, all of you, and it's very good. And you talk about this aspect because the future is in your hand. You are now the actors of the tomorrow strategy. You must inform your colleague. You must work together in order to prepare the different future for all of us.